a lot of disease experts are rather driven by advocacy. And in Global Burden of Disease, one of our principles is that we want to decouple advocacy from epidemiology to get rid of all these wild claims of how many deaths there are from a particular condition or how many people suffer from a condition, which often tend to be inflated if it comes out of people who do it from a particular disease perspective only. In Global Burden of Disease, we instill a discipline on ourselves that we want to avoid double counting. So the same case cannot sit here and at the same time sit there. We found very few credible sources of information that tells us something about the severity spectrum of these very important disorders. And because many mental disorders range from very mild to very severe, it is important to get an understanding of that spectrum. Fortunately, there aren't any established, credible ways of measuring severity. So we developed our own method from just a couple of surveys in high-income countries. We dearly want to replicate that in other countries and get a better idea of how severity patterns vary between geographies, but importantly also how severity patterns vary across the globe depending on access to treatment on the overall burden of disease.